Hello students, today's topic will be CEJ, cemento-enamel junction, and CDJ, cemento-dentinal junction. This is a very short topic, but it does have some important and often repeated words, so please pay attention. Under this topic, we'll be seeing about the OMG rule of cemento-enamel junction, about the cemento-dentinal junction, intermediate cementum, and the significance of the cemento-dentinal junction. OMG rule of cemento-enamel junction. Relation between the cementum and enamel at the CEJ can be of three types. That can be remembered by the OMG rule. O is 60% of cementum overlaps the enamel. M, 30% of cementum meets the enamel. And G, 10% gap exists between the enamel and the cementum. This 10% gap has the risk of sensitivity and gingival recession. This is a very important and often repeated MCQ. 60% cementum overlaps enamel, 30% cementum meets enamel, and 10% there is a gap between cementum and enamel. These are the only three types of relation between cementum and enamel, so kindly remember them. You can see in this image, first one, the cementum overlaps enamel. 60% of cases are seen like this. Second one, the cementum meets the enamel. 30% of cases are seen like this. And in third image, there is a gap between the cementum and the enamel. 10% of cases are like this. Moving on to cemento-dentinal junction. This is the cemento-dentinal junction. The cementum is here. Cementum is a part of the root. We all know cementum and the dentin, they meet at a few mm above the apex of the root. That is the cemento-dentinal junction. Width of the cemento-dentinal junction is 2 to 3 micrometers. Terminal apical area of cementum where it joins the root canal of the dentin. The cemento-dentinal junction is smooth in permanent tooth. If you can see in this image, cemento-dentinal junction is smooth, whereas in the deciduous dentition, cemento-dentinal junction is scalloped. Moving on to intermediate cementum. Dentin is separated from the cementum by a zone of intermediate layer or the hyaline zone, called as intermediate cementum. You can see in this image, cementum is here, dentin is here. The dentin and the cementum are separated by a structureless area called as intermediate cementum or the hyaline zone. It is seen in the apical two-third of molars and premolars, but it is rare in incisors and the deciduous teeth. Hyaline is where the Hertwig's epithelial root sheath is trapped. So in the intermediate cementum only, you can see Hertwig's epithelial root sheath being trapped. Significance of the cemento-dentinal junction. Areas of dentin adjacent to the cemento-dentinal junction appear granular in ground section due to the coalescing and looping of terminal portion of dentinal tubules called Tome's granular layer. Now the first significance of cemento-dentinal junction . The first significance of cemento-dentinal junction is the presence of Tome's granular layer is near the cemento-dentinal junction. This is the granular layer of Tome's, dentin and the cementum. Area of dentin adjacent to the CDJ. So this Tome's granular layer is present adjacent to CDJ. During root canal treatment, the obturating material should not go beyond the cemento-dentinal junction. So these are its two significances. Number one, you can find Tome's granular layer near the cemento-dentinal junction. And number two is during RCT, The root canal obturating material should not go beyond the cemento-dentinal junction. That's all, students, for this topic. Moving on to MCQs. What type of cementum enamel relationship is more prone to gingival recession? Option A, cementum overlaps enamel. Option B, cementum meets enamel. Option C, gap between cementum and enamel. And option D, none of the above. Answer is option C. There is a gap between cementum and enamel. Only in that type of relationship, it is more prone to gingival recession. Question number 2. Termination of obturation material in root canal treatment should be done at dash. Option A, cemento-dentinal junction, CDJ. Option B, cemento-enamel junction, CEJ. Option C, dentino-enamel junction, DEJ. And option D, apical constriction. The answer is, always remember, termination of obturating material should be done at cemento-dentinal junction. That's all, students, for this class. Thank you.